second most important thing, what happens in our body is, see, every person, as I have told, there is a balance between male part and balance between the female part. Every person has got testosterone, has got estrogen. Males also have. Similarly, females also have, because we have gonadotropin hormones which are getting released from the higher pituitary center. What happens now? That there is a hormone which the liver secretes, is the sex hormone binding globulin. This is a specific protein, and this protein is the most essential protein which plays a very vital role in PCOD. Guys, you all fail to understand the pathophysiology, and we just misinterpret the symptoms, and in every case we are just running to find out the identity crisis, or we are just trying to find out ki where the femininity is lost. No, every time, in every case, this is not there. You have to see ki what is the presentation, what is the predominant symptom of PCOD. Is it menstrual irregularity? Is it amenorrhea? Is it infertility? Is it hirsutism? Because this is individualization, what we have to see in every case. This is a true homeopathic approach, right? And you have to understand in totality. Every person will not come to you along with PCOD with weight gain. I have so many cases, they are lean thin, but they have PCOD. Every patient is not going to come you with hirsutism. Every person will not come you with infertility. So every symptom at level of the patient has to be unlocked, and you have to understand every symptom, what it is trying to say and what it is trying to speak out in the case. So the history has to be correlated and deciphered at that level. So when you talk about this SHBG enzyme, what is a protein which is being secreted, the work of SHBG is, in females especially, is कि testosterone को चिपक के रहना. The role is testosterone को bind करके रखना, so that the free testosterone level in the body doesn't go high, and there is less hormonal testosterone level. But what happens, because of some genetic factors, or because of insulin resistance, or androgen excesses, this SHBG in males, what happens is, this SHBG level in males is very low, whereas in females it is very high, because the role of SHBG is to join and to bind. But when you are under very much stressful phase, and when again the androgens are very high, the cortisol's level are very high, suddenly the liver has to function somewhere else, and these proteins which are very important, very essential, they go down. This SHBG level going down, that means the free testosterone levels will go high, right? So this free testosterone level going very high will result into hirsutism. Male hormones going very high. So if male hormones are going very high, there will be lot of aggression, lot of competitiveness. Male part will dominate the female part, and when the male part starts dominating, the female wants to live a life like a tomboy, like a boy. She doesn't want to enjoy the femininity. She doesn't want to dress up like a female. She doesn't want to look beautiful. She wants to look more like a male. So the pear shaped face goes to hyperandrogenism, goes to hirsutism, lot of stretch marks. The body shape, which is supposed to have a pear shape, or the pelvic, which is a female pelvis with a beautiful shape, with a beautiful structure, everything gets ugly looking. And the competition of being a male, the desire to become a male, the desire to behave like a male, desire that I want to be male, will reduce further SHBG enzyme in your body, leading to more of hirsutism. So when you see more of hirsutism, go and find, yes, definitely there will be a consequences where the role comes up. There will be confusion of identity. Am I a male or I am a female? There you take confusion of identity rather than taking in every case, right? So going further now, as you all know, this estradiol, testosterone, they all play a very important role. And the AMH, that is anti-Mullerian hormone, which is very very essential hormone, which tells you about the efficiency of the ovaries which are functioning, or the ovarian functions. What happens when androgens, they go out, they go high, you will see that AMH is also going high, because now the quality what AMH has to do is, estrogen जो testosterone release हो रहा है, जो higher level of testosterone release हो रहा है, उस टेस्टोस्टेरोन के रिवर्स में एएमएच भी इंक्रीज होता जाएगा। क्यों? क्योंकि एएमएच का काम है ईस्ट्रोजन को कम रखना और प्रोजेस्टेरॉन को बढ़ाना। जितना अच्छा एएमएच होगा उतना अच्छा प्रोजेस्टेरॉन लेवल बढ़ेगा। लेकिन प्रॉब्लम, व्हाट इज द प्रॉब्लम इज, बिकॉज देयर इज लॉट ऑफ टेस्टोस्टेरोन, सो टू combat that need, the AMH also goes on increases, and you will see that all the females who have PCOD, they have high AMH level. And if a person has got a problem at the AMH level, mind well, the reproduction will definitely be abnormal. So the patient will come to you with infertility. The doctors say that this is ovarian failure, and even they will land up to early menopause, or a strong history of amenorrhea which is there for 8 months, 9 months, 10 months, not absolute, even no bleed. So this is where AMH plays a very important role. So AMH is very important to keep this estradiol or the estrogen into control, and increasing the progesterone, that is the endometrial cycle or the ovarian cycle. So again, playing an important role in developing fertility. So again, since androgens are increased, stress is increased, lot of anxiety, lot of panic situation which will be there. And since there is disparity, what I am, how should I behave, the cortisol levels are also disrupted, because there is a stress, and this results into again a resistance to respond to the follicle stimulating hormone, more leading to increased AMH, more progesterone which is not there, leading to infertility. So this is how you can correlate and unlock infertility. So if infertility is coming to you as a predominant symptom, look for AMH, anti-Mullerian hormone. And this is a primary hormone which is secreted from the Graafian follicle. So this Graafian follicle, if it doesn't mature, it is not properly functioning, AMH gets disrupted. So this becomes very important, since this hormone is directly released from the ovaries. So this is identity, the femininity, the identity of a female. The problem will be somewhere the person whom he attachment identity. If I feel that my profession is my identity and there is some problem with my profession, their identity can be something very vast. If I identify myself as a daughter of the family, and I am representing as a daughter of the family, and if someone is not appreciating me, if the person is not appreciating me as a female, and there is lot of conflict going, that I have to compete to the male world, so I'm fighting with my own self, there's strong fight which is going with my own identity, and therefore the AMH is disrupted. And there you can see in these cases, even that during pregnancy the mother had suffered from the problems with the male part, so this AMH is disturbed. So this is where the individualization comes up. So if you find AMH which is disrupted, a person going into ovarian failure, a person going into premature menopause, go directly and ask where the mother suffered the problem of this gender discrimination, or there was a huge and tremendous pressure on the mother for giving birth to a male child. So that has to be there 100%. Sir says कि this is mathematics, and I am telling you कि this is real mathematics, it has to be there. But in every case, go and unlock the symptoms what body is saying, because body is reflection of the mind. You cannot directly go to the subconscious level, but body will show you the mirror image. Yes, this is the problem and this is my suffering. So going again to this insulin resistance, why this happens? So as I have told you, because of androgens which are getting increased, the free androgens that uh, increases the synthesis of fatty acid at the liver. Now this problem, what you will again correlate, since the problem is coming from the liver part, so there will be lot of insecurity of survival of the future, because the mother has suffered during pregnancy or in childhood. The child has suffered lot of problems where there was lot of insecurity of survival. I'm not in a safe zone, I'm not protected, my future is in danger, I might not get sufficient love, I might not get sufficient nurtured by my parents. There is family conflicts. When you talk about liver, you talk about family. When you talk about fatty acids or the lipids, you talk about future insecurity. So when you find that in a lady there is lot of insulin resistance with lot of obesity, so lot of insecurity, the child has to be insecure child with lot of problem and pain in the childhood. So go in depth and find out the childhood conflicts. Here you will definitely get that the child was being challenged, there was a challenging childhood, not secured amongst the own family member. If you remember all my cases where I have shared all the PCOD cases, you can just summarize those cases and find out how you correlate every beautiful thing, and how the symptoms can unlock from the mind, from the body to the mind, and go directly to the cause and the origin of the problem. Don't waste time in hunting something, and don't get biased with only rubrics like identity errors of, or rubrics like confusion of identity. No, every time it is not going to be there. A fear of poverty can also come up with PCOD, because that insecurity landing up of losing my own, a fear of losing my people, of insecure childhood where I'm very fearful. Lot of carbons come up, lot of calcareas, minerals come up in this group. Why? Because there is lot of insecurity, and this insecurity is because the liver metabolism is being affected, and this liver metabolism is affected, leading again to lower level of SHBG which is to be produced, and more of testosterone, because now the stamina will be, I have to fight, I cannot stay insecure, I have fears, lot of insecurity. So what, how can I combat that fear, how can I combat the insecurity? I have to run, and if I have to run, I need to have lot of cortisol level, lot of androgens which will give me strength and energy to fight back. So in result, lot of glucose will be required. So this leads to disrupted insulin level. The body will give lot of insulin, because what pancreas are seeing, ki the glucose are not getting metabolized properly, there is no primary function at the pancreatic level, but the primary disruption is at the level of liver. So a lot of insecurities you will see. I hope I'm really clarifying each and every symptom, because this you will find in each and every case, and this will help you in individualizing and going to the depth of each case. Not only just seeing this as PCOD case, but go and see uh, uh, what complaints the patient is presenting, what reports have got disturbed, and how the body is reacting. So again, hyperandrogenism leading to insulin resistance, and as a feedback mechanism, because of hyperinsulinemia, the gonadotropic releasing hormone is disturbed and AMH is increased, leading to again an increase in luteinizing hormone and less of follicle stimulating. The reason behind this will be because I'm insecure, because I am so much scared, because I feel that I am not in an environment which can protect me. So how can I come out of this shell? So I let me remain in this ovarian follicle only. The ovum, the oocyte takes this as a danger, takes that. You can even take the rubric like fear of getting injured, delusion of injury receiving, that insecurity which goes, and therefore because of that stress which is there, I don't feel that the environment outside is safe for me. The females are not safe in this world. My mother has told me that no, 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 baba, you cannot go alone in the night because someone will take advantage. I cannot tolerate the bad touch because everyone is looking at around me, and everyone is trying to harm me, and everyone is trying to injure me, and that is overpowering me and my mind. No, I cannot take that risk, and therefore let me remain inside my shell, and this leads to failure again to ovulate, and lot of LH surge. Still the ovary are resistant. These are very obstinate people. You will see they are headstrong, they are very very obstinate, and they are resistant to change, and therefore they fail to ovulate. So this is where everything happens. Now because of hyperandrogenism, how you can understand through the body is you will have lot of acne, male pattern of baldness, lot of virilization, that is lot of masculinity which is developed, abnormal hair growth. These will all tell you that there is lot of stress which is going on, and this can be post menopausal also, and lot of androgens which are there. And this all what we have seen, like lot of androgen, insulin resistance, low hepatic sex hormone binding globulin, this all will lead to a follicular arrest, and the AMH goes on increasing as a response, leading to obesity, leading to hirsutism, acne, hair fall, thinning of hair, gaining weight, infertility, loss of libido. So this is where how you see. So lot many cases you will find. I will go again back to this slide, that in lot many cases we have seen that it is not every time that you will get a PCOD case, but you on USG everything comes up to be normal. So there, don't prescribe calcarea. Don't think of carbons, because insecurity is not there at the mental level or at the liver level, because there they will not be so much insecure. You will not find anything in these cases in the early childhood, but definitely if you find something at the ovarian level, or at as multiple follicles at the level of ovaries, you will have to search for the insecurities, and even individualized to the level of left and right. You will see that some cases the right ovary is more bulky, or the CC, the weight is more, with lot more follicles rather than the left ovary. So the reason has to be the partner, insecurity with the partner, or insecurity at the level of father or the work area, because the person starts to identify the profession, the work as their own identity or the matter of existence. And similarly, when it comes to the level of left side, you will see problems they are facing with the children. They are facing problem when they are unmarried with the mother side, or with the family or someone they are very close to. I have seen hundreds of cases of PCOD, and I can challenge you that this is what we have seen, and this is guaranteed, because every case I am trying to correlate at the physical level and the emotional level. So this is a complete package what I'm giving today. This is an experience of hundreds and 200s of cases what we see day in day out. So go and check out with these cases, and you will find this happening. So going back to the case, any doubt with unlocking the body? Now come on, now anyone can take efforts in guessing what should be there in the life. This is what predictive homeopathy is. When you unlock the symptoms, so the symptoms, what are the symptoms over here? Weight gain, hirsutism, spotting, mood fluctuation, sleep disturbed, and the test they are talking about lot of cholesterol or the lipids level which are high, the mh which is high, fsh and lh which is disturbed, and definitely prolactin is normal but serum insulin is at the higher level. Are you able to read the document? Should I enhance? Any problem till now to unlock the symptoms? She's a child who suffered from recurrent cough and jaundice. She was admitted for typhoid, and she also suffered from malaria. She had COVID during the second wave, but minor symptoms. She has been vaccinated, and last year she had chickenpox. That is very late age. When now she's 18 years, and she had this viral chickenpox at the age of 17 years. This is also something which you have to think about, that this is a psychosis which is predominantly coming up as a miasm. So father, he is in IPL. He is a manager of IPL team, and he is a chronic alcoholic and has been suffering with allergic rhinitis, asthma, and during COVID time he had some major lung collapse. And mother is just 43 years old female who is suffering with hypothyroid. She says that during every time I get very scareful and very fearful dreams that someone is hitting someone and I'm seeing from behind, and I cannot close the doors because I'm so much scared. And the person says that I'm so scared of all these things that I don't want to watch horror movies, and I sleep with an open door, and I always see dreams about my parents, that there is some disharmony and arguments which is going on, and they are hitting each other. So dreams are the first window to enter to the subconscious mind. Dreams are the first window to enter into the zone of your subconscious mind. So the first thing what she talks about is the insecurity what she has. She says that since childhood she had got good appetite, and she did not demand much of breast milk, what mother says. Otherwise she has craving for milk and sour thing. She likes eating lot of spicy things, ice cream, cold drinks, and she has got aversion to eggs. What she describes as ki, we being Punjabi, still I feel that the process of hatching an egg, and the hen is really forced to hatch an egg, is really a very painful process, and therefore I don't like eating non-veg. This is the reason, because I cannot take that pain. Someone was then she says that I can. Sorry, there is some problem. Yeah. So hunger she can tolerate. She's thirsty, and she is thermally hot patient. Want AC winters. She's constipated most of the time, and she takes jeera water and she gets relief. She gets coldness of palms and soles, and want at night warm to touch. She has scanty perspiration. She says that her senses are very good. I will go a bit fast. I have fast intuitions indicating something, that whenever I get a lock, my feet get stuck or hit by a wall or something, I fall down, I feel that yes, something is wrong going to happen and my parents are going to fight. I oftenly see butterflies, white butterflies, and but I'm in a dilemma that why I see them, I cannot understand. She's right-handed. She has got sun aggravation. She doesn't like to be touched. She doesn't like sharing her things with her friends or someone. She doesn't like sharing her tiffins. her clothes to anyone. She is a fearful girl, having fear of thunderstorm. She doesn't like going out too much. She wants open air, and she feels suffocated in crowded places. What history we could get is, according to mother started talking. They both come together, and there is a very sweet bond between the mother and the daughter. I see them playing with each other small games when they are sitting in the waiting room, and they are very when they are together, they are in their own zone. They don't need any other person. So this was the bond which I could feel between a mother and the daughter. So mother says ki she has been a very dominating kind of a girl, and very stubborn and moody, very difficult to console her since beginning. And since we have been we her father is in IPL, and we have to continuously, we are moving somewhere or the other, and therefore she doesn't have a permanent place where she would have stayed for a pretty long time. She has got more the company of boys, and she likes to dominate even the boys. And she says that since father is continuously busy and occupied with the work, they don't have time to spend with each other. And even patient complains that father is never available for me, and I have a lot of pressure to take care of this child. Mother was a school principal in Talegaon, but because the patient insisted, the mother had to leave the job, and it's very difficult to handle this single child, and therefore I had no option rather than quitting the job. She respects everyone. She's very conscious and curious, and she's very creative girl, a delicate looking girl. And but she says that she's very curious, and wants to know what is happening in mother's life. And as I told you before, she is very possessive, doesn't like if someone is drinking from her bottle, because she is very fastidious and she feels that it must be dirty, feels weird. Mother said that she talks in raised voice, and she has a high pitched sound, and she's too managed to talk sometimes. She doesn't want to share any her parents with anyone. She's too possessive for us. And since father is of independent thought process, loves her father, but something is missing from father. What she says that we me and my mother are just like an open book to each other. We know each and every secret of our life. But this is not true with our father, because we don't spend time each other. And I don't like, because my family members always try to put pressure upon my mother, saying that being a female, I will get spoiled. But I'm not like that. I am a very patient lady. I'm just like a goddess who wants to take care of every child. And I really, mother says this, that I really take care of my child very well, and I've devoted my life taking care of my child. This is why I have left the school also. And during the school time, which was a very crucial time period of the life, the grandmother played a very mischievous role. And the grandmother started abusing and saying that this girl is a spoiled brat, and she is very obstinate. She has affairs with boys, and she tried to humiliate her, and spread some wrong news in the family and around, because of which the child was very much hurted in her 11th standard. Do you remember that till 10th and 11th standard her menses were absolutely normal? After this incidents, somewhere around that, her menses started getting disrupted. She doesn't like to back answers to the elders. She used to shout on mother and dominate, and used to cry while missing father. Sometimes she becomes arrogant even with the mother, when she's not able to express her anger to others. And since they were in the same school where mother was the teacher or the principal, she says that my friends were never true friends, and they always took benefit of me, and they always behaved in two ways. In front of my mother they would behave differently, and behind they would behave differently. So she feels that they were very selfish selfish with them, and therefore there was lot of lonely feeling since the childhood, and there was no some sibling around to with whom they could share. And she says that she's very defiant girl and she's very obstinate girl, and in studies she's really very good. She understands all the concepts and understands how to read and everything. She's a good vocabulary. She's good in arts and crafts, but she's not good at mathematics, and she doesn't wanted to pursue a science career, so she has opted to go for an arts faculty. She has got a voice which is loud, and she can shout and strike others when in anger. Last time also, when Nana Nani had came visited their home, she misbehaved with them sometimes when they were trying to find some fault in her, and she would later on regret for their behavior. Father always wanted her to go for cricket since he's into profession of cricket, and she was being forced to play cricket, and she won't desire to play cricket because she always wanted to go for pursuing UPSC, and she has lots of expectations from herself. She says that I'm a girl with lot of emotions inside, and I'm like, I would love to go for psychology and fiction rather than going for adventurous life and going for sportsmanship, because I'm more into an introverted girl, and I love enjoying traveling, swimming, and mehendi and arts. And I'm people used to call me tomboyish because I was dominating on them, and I was like kunda gardi wali. This is what people have an opinion towards me. Then mother talked about her pregnancy. She herself went back that her childhood was also not very good, and even my pregnancy was not very good, because this was somewhere not a consanguineous marriage, but it was a known family. My father's one of the friend, and my father-in-law was very good, and he would always protect me. But my husband was more selfish and oriented towards his own self. He took care of my self during pregnancy, but that was more oriented towards his own child rather than going for me. And I had three sisters and only one brother, so since childhood I had been facing that problem of a female child. And similarly in pregnancy time also, that this discrimination was overpowering upon me, and everyone wanted that there should be a male child. And even somewhere in the corner of the heart, I wanted that I should have a baby who is a male rather than having a girl, because girls have to go to other home and deliver babies, and girls have to take up lot of responsibilities, and they are not given freedom. So this was being imbibed upon me, and this was there as a strong thought which came during pregnancy, that I should have a male child. So this is where the identity started changing, that in spite of having a female child in the womb, the desire was to have a male child. So this is where the androgens are getting disrupted, identity is getting disrupted. Father had told patient that boys are not at all good, and therefore you should get more independent and don't think of getting married to any Tom, Dick, and Harry. So I have developed somewhere in my heart that I don't like males and I don't want to get married. I want to get first settled. I want to run independent life rather than getting dependent. And since childhood, since the environment in the family is not good, my father is not paying attention to us, and I suspect that my father is a very greedy person and very selfish person, and who is just concentrating upon himself. And my mother has been at the suffering end, and my I always protect my mother and argue with my father, because I feel that my mother is really a sufferer, and she says that we have to be practical and not emotional. That is what she feels, because she has lived her life purely, but I feel that my friends, my father have really ditched us. And I have a very strong feeling that some psychologist ma'am who frequently visited at our home, my father has got an extramarital affair with her, and this is a very strong feeling. And even in Diwali days, I have seen that my mother is very lonely, and even I am lonely, and my father doesn't pay attention to us, and there is a not a good environment at home. And even I feel that I have been cheated by my friends when I was in 10th standard. They were very good with me because I was a principal's daughter, or a father it was in IPL, and they would just take out advantage and just throw me out. And so there was lot of loneliness, and in front of my parents they would show that they are so good, but actually they were not good. And she was elder. I have only one friend who was very mature and understanding and a calm girl, but I was very straightforward. And before I was very friendly, but now I have become very shy and introvert. I don't want to hurt anyone by showing my feelings. Some friends abuse and they use bad language, so parents think that they are bad, but according to me, they might be using bad language, but their heart is very good. So mostly I avoid telling people about my parents, because I want to see if they are friends with me because of my background or because of my individual personality, and I don't want now anyone to take my benefit. With my cousin sister, I am very much attached. We have spent lot of time together, and we share good secrets. My buddy mummy is jealous of me, and my dadi has also played a very vital role in spoiling my mother's life. She doesn't want us to be happy, and she takes out all her anger on my mother. And she knows that I don't have anyone in my life apart from my mother. Still, she will throw all the anger upon us, and I don't know how to express my anger upon her. I get very angry often, but my anger is not being expressed. I just want to throw things and just release my anger, which is very difficult for me, and I get irritated very fast. My father, as I told, has got an affair, and I feel very bad and sad for my mother that she cannot enjoy her life. And therefore, if I have to solve this, I have to accept the way I am. And I feel that I should grow very fast, get independent, and have to set a deadline of 21 years to clear my UPSC. I have to work day in day out and pursue a good career, so that we become independent and we are not dependent on the father for the mother, and we can live a very good life, so that we are not feeling depressed when we think about a father. And during lockdown, many things have happened, and I was very much depressed. And from outside everything is glamorous for the world, but when we peep inside, there is simple sadness and loneliness. I want to be happy. I desire to have a healthy relationship. I want to see my parents staying happily. I want a good family life. I feel very helpless that I cannot do anything, and I sometimes even blame myself that because of me, my mother has to tolerate my father. Otherwise, she would have better life because she was an independent lady. I want to be very honest. I really had a boyfriend, but that friend was just an emotional attachment because he was supportive to me, but there was nothing beyond it. But my father blames that I am responsible. Uh, I Father always fight with my mother that I have my mother has not brought me up properly, and I have broken the faith, because of which the relationship is getting spoiled. This I cannot tolerate and really hurts me. And the in the night I really get those scary dreams, and I cannot avoid these thoughts, and I cannot sleep alone. Dadi has really spoiled my image in front of everyone, and I don't trust my father at all. I think they have an affair, and mother and me are suffering because of him. And she again started crying at this moment. So much is happening, and father is enjoying everything with that lady, and me and my mother are left alone behind at the home. I get very angry, but whom should I say? My father has got an image and reputation in the society, and I'm seeing my mother suffer from the childhood. Father has ignored us, feel very hurt, feel like crying, and I think I will become independent and will never meet him in future. I don't want to marry, because wherever I grow, I will take my mother along with me, and I don't know, my better half will accompany my mother. I feel very lonely. I'm very unhappy that in my destiny I got to see so many things at early age. All things are making me very strong, but I don't have attachment with my father. I have hatred and anger towards them. Whenever he comes, feels that when will he go back? Since childhood, I was very cheerful and trust anyone, but now I have become very shy. I was very dominating in a very positive way with leadership quality. I would like to help others. I'm not shy. I was very conservative. I overthink, get offended, and hurt easily, and cry over trifles. Always wanted a sibling to share my loneliness. I feel that everyone is just there to bring me down, and I'm not happy. And I feel that everyone is jealous of me. In 10th standard, good, I got less marks. Uh, Dadi, I feel that Dadi is doing something against me, and she's mixing something in my food, because whatever I did not want to do ended up doing that only, because I faced many failures. And the way I didn't wanted to behave, I always wanted to be a calm and quiet girl, but I became very angry often. So I feel that Dadi has done something wrong. That time, heavy, emotionally drained, got spiritually involved into meditation to resolve this problem, but still it is very difficult. I'm very angry, and anger is expressed on food. I stop eating, or sometimes I go and tend on overeating, releasing realizing that I'm happy hormone which is getting released when I eat a lot. So everyone is jealous of me because I'm good in studies and I look good. Even my dadi is very jealous of me. My father was not a wanted child, and therefore whatever anger she has for my father is being thrown up upon me. She favors the kids of my bade papa and bade mummy. I don't like girl and boy discrimination. I don't want their property. I can't follow their instruction. I need to be an independent life. Anxiety, a lot of anxiety issues when parents suffer something. What will be my future? How will I live alone? I want to have good friends. What should not be left behind? I should have some company. I always face that anxiety. What happened to my mother and my parents? What will happen to me? I want to pursue civil services and get independent. Till ninth, I had very great childhood, but everything got stressed up after 10th standard, and there was no pressure of studies from my parental side. But I always wanted to study and pursue a good career. I want to live a happy and healthy environment in family, and I'm not a person who is running behind materialistic thing. I want love and care, protection from my father. I don't have very close friends because I feel very lonely. That no one should judge me because I am very much image conscious, and I cannot trust my friends, and I am not prepared for failures in my life. So I want that everyone should appreciate me. I want that everyone should accept me in the society. I cannot take my bad name. So this was the whole story of this case. So have you all come up with the interpretations? Now you can all feel where the androgens have gone up. What was the stress factor in her life since beginning of her childhood? In the internatal life, what mother had suffered is being depicted in her own life, because in the pregnancy state what mother had was a tremendous pressure of having a male child. There was discrimination in the society, and she wanted uh, doesn't wanted she wanted to have freedom and didn't wanted to have a restricted life. So this was the overall picture of the complete case. Anyone has come up with the totality? So what was the sensitivity of this patient? Can anyone tell me what was the totality? Because analysis, yes, I think people are not there available, or you are there but not active. She is an obstinate and headstrong girl. She is reserved, dominating over friends, boys. She is tomboyish. She has hatred for father, and all her stresses are because of father, because of which she has lot of anger issues. She is more attached to mother and has can feel the pain the mother is suffering and the injustice she is facing, and she wants to fight with it. She feels neglected, and there is lot of forsaken and loneliness which is there. She is more of possessive female. She feels being insulted and image being spoiled by grandmother. She is suspicious and she suspects that grandmother has done something against her. She has got lot of anger. She's offended easily. Lot of loneliness. Bold lady, tomboyish, angry, and intellect is good, ambitious. She's more towards arts and creativity. She is quarrelsome, can fight back to her father, also affected by parental dispute, lot of insecurity for the future and anticipatory anxiety. She's attached to mother and therefore lot of fear of being separation from mother. She cannot tolerate injustice what mother is suffering, and she has been deceived by her friends and family. She's oversensitive, and because of which she gets angry, lot of hatred, and in anger she just don't want to talk. This anger is unexpressed, and in this anger she eats more, and she's very sensitive, caring for mother. Because of all the family situation, she is so much insecure financially. She wants to get independent, and because of which she wants to grow fast and settle her mother. There is an internal grief state with lot of helplessness, and she blames herself for the situation and the pain the mother is passing through. And she has aversion to get married, and suspicious and sensitive to this gender discrimination. So as we have taken this case, we could understand that why the whole cascade is there, what insecurities she has passed out. We see that there is lot lipid changes, AMH has gone up, there is follicles, there is increased insulin resistance. So we can correlate her family situation. Why insecurities? What father has played an important role? She is more attached to mother, but there is insecurity of being separated. The AMH has gone up because of hyperandrogenism. There is continuous stress. She has lost that identity of a female, and she wants to behave like more like a male, and therefore lot of hirsutism has gone up. So lot of insecurities. And see here, there is an instinct with mother has given of sensitivity of gender discrimination. Therefore she, being a female also, she wants to behave like a male. And the most important thing is she's suffering because of father, and the core feeling of her suffering is because the father is being neglecting them, and father is not behaving well with them, and therefore she feels that I should grow faster. And because of which the rubric what I have taken over here is time passes too slowly and things appear too longer. She feels that her life is just lingering, helplessness is there, and now she just want to fasten up everything, and she wants to just finish her education. She has kept the target that she wants to become financially independent at 21 years of age, and she feels that all her life is getting stuck up, and she wants to just get independent, grow much better, and lot of insecurity which is there. So therefore the next rubric what we have taken is the core of the case is delusion that she is being neglected since childhood. The intranatal life, the mother has also transferred the emotion that she was being neglected in the society by the parents, and there was strong feeling of being um discrimination and gender discrimination, and therefore the core feeling which goes that yes, my identity is somewhere getting disrupted, but more than that is all the suffering which are coming as a ailment from being neglected by the father. Now, going to the remedy differentiation in this case, the remedy is one amongst the eight remedies. If you go to sepia, you will see there will be lot of indifference, but this indifference is not this there in the girl. The expression of anger, that she wants to eat more, she goes into mood swing. Yes, sepia will also have, but sepia will develop lot of nausea in the morning and aversion to eating rather than overeating, because sepia will go towards the side of more of indifference and sadness. But here she wants to go towards the more of the positive attitude of achieving things. She wants to achieve, she's more of ambitious girl. So therefore, remedies like pulsatilla will more into weeping. She's not going to that timidity phase, she's a fighter, she's facing father, she wants to fight back. Yes, natramute, we can think about, she is having grief. She has got lot of suppressed emotions, suppressed anger. She's a loner. Naja is a conscientious ophidia, coming from the extrovert category, but she is not an ophidia. She doesn't have expression of naja. She is not from the category of marble or calcarea carb. Argentum nitricum also can have lot of insecurity, but fear of height, fear of closed places, insecurity, lot of achievements and want to secure that place has can come up. So we can think of a remedy which is ambitious, which wants to complete the lifespan very fast, which has got that feeling of being neglected, feeling of forsaken, and this is dissatisfied because she's being deceived. She's a obstinate girl who is being offended easily, and she is a female who feels that the time passing slowly. So the remedies which are coming up in this case are pulsatilla, argentum nitricum and palladium, to be differentiated with other groups like lachesis. Natrum carp also we can think of in this female, because she has got an artistic aptitude. But yes, thanks Nisha ma'am for being there as an active participant, because I thought that no one is there to participate today, so I was going bit faster. So yes, you are perfectly right, the remedy is palladium, because it belongs to the series of silver group, and silver series, and palladium is a remedy which is having more of artistic aptitude, which are sensitive, they want lot of appreciation. And for them, yes, the looks what she had, she's a beautiful girl with beautiful image, and she is being over pampered by the mother. She is an ambitious girl who wants to secure a good position, and because of which she wants to become she was forced by father, she wants to have a good image in the society, she wants good opinion of from her grandmother, she wants good opinion from her father, she wants that father should love her, should respect her. But there is lot of delusion of being neglected, and there is lot of neglection from parent, from friends, also from family, because of which she has become lonely, and equally she is very haughty and obstinate, difficult to console her. So there is a very strong and violent expression of her anger, but those angers are being suppressed, and therefore she feels that her life is not moving fast, because she wants to gain her position. Usko bas aisa lagta hai, as early as possible I should get independent, just move away from this situation, I should not communicate with my father, because she says ki once I meet my I get independent, I will just disconnect from my father. So strong hatred for father and so much of insecurity. So this is the end of the lecture. And as I sum up, I would like to share that imagination is more important than the knowledge. So more intuitive knowledge you will have, more knowledge of lateral thinking you have, you will be able to imply it into your cases. So you have to think beyond what is there in the book. The pathology what is available in the book is visible, but you have to just unlock the symptoms also, what this invisible mind is trying to say, what the imagination of the patient is trying to say, what delusions this patient is carrying, what thought level the patient is carrying. And definitely you have to apply it in the cases. So this is end of the case. Nisha ma'am, I think you are there and me. If any doubts, anyone else can just ask the questions if anyone has any doubt, because this was a beautiful presentation of how to unlock the whole pathophysiology. And because we as homeopaths really sometimes don't give importance to the pathophysiology, and we feel that we want more of what we say, we want more of importance to the symptoms and individualization. But symptoms and pathophysiology itself guides you to the individualization and unlocking the mind at conscious and subconscious level. So this practice has to be done at every level. Anyone has any doubt, any questions? Yes, Dr. Kusum ma'am. Yes, there is want of appreciation, but the core feeling is want of love. She wants harmony in the family. And Kalkaria's self is more of materialistic. If you have listened to the history, you must have observed that I said what the patient said, that I want love in life. I'm not into materialistic world. And Calcaria self is someone who would like, who wants more of appreciation might be there, but that is because of out of that materialistic want and desires. Calcarea self, Calcarea floor, they come into that plane. But when you talk about sensitivity, you talk about emotions, you talk about love. And equally the way she is leading her life, she is not leading her life by cheating someone. And Calcarea self is a non-conscientious remedy. And here you can see there is a whole history. She wants to get into a secure place, and so that she equally she feels that though I am insulted, but now I want to gain a good position. If I clear that UPSC, I get a secured life, I will be able to give protection to mother. This is not the core feeling of Calcarea self. This is not Sora of Calcarea self. Here Calcarea self will not come, as if Calcarea self is more of aggressive. The wounds of Calcarea self, they never heal. She wants to run away from this life. Relationship is really very important to her, and she wants, though she has hatred for father, but I'm very sure if father comes back to her giving a tight hug, giving respect and apologizing to her, she will melt down. I have talked to her, and over a period of time she's allowing me to enter more deeper and deeper into her subconscious mind. And lately she has really appreciated everything. Matlab, this case has unlocked, and after giving palladium to her, her weight has been lost 10 to 12 kg, her menses became normal, and the love, now she doesn't have animosity. She says, my mind has gone very calm and quiet. Now I don't have that stress what used to feel before. And this feeling of growing fast so that I can protect my mother, I want to just complete my life tenure till 21. This target oriented will be more towards a metal quality. Thank you. Any other question? Yes, Dr. Geeta, you have written ki there is probation. In Palladium, there is love of approbation, that is limelight, which lays its victim and as easy prey to slight, real or imaginary, and easily gives place to a state of wounded pride. Yes, here also she is saying so many times that my badi mummy, my dadi doesn't wanted me to be in a good and secured position. She wants a good position, she wants a limelight, but in a good way. Yeah. In PCOD cases, I would like to connect to you again and again. If you understand the pathophysiology of PCOD, you will find that there is insulin resistance. There is lot of insecurity at the level of mind, affecting the liver metabolism, affecting the fat metabolism particularly, because of which the adipose tissues is getting collected, and there is lot of stress, and this stress is leading to lot of insecurity and lot of obesity. And if the stress has to be released, so there is a major role. I have not added the slide over here, but there is a major role of exercise, of diet, while you're dealing with the patients of PCOD. And I have seen so many cases that before they would never exercise, they were very lazy, they were very kind of people, but when they were being treated with a right constitutional, the desire to exercise enhanced, they the self love increased, because somewhere they become so because of identity crisis, or you say ki, they lose that love of self, and they just don't want to love themselves as female. So dressing up, beautifying themselves, everything really helps a lot. And therefore what I told about therapy was metformin, and therefore you will see maximum gynecologists prescribing metformin to all the PCOD cases, because it helps in coming down of insulin resistance. But friends, we are not here as allopathic doctors, we are not here to treat the consequence. We have to go to the cause of the disease or the ailment, from which become most important of in treating these cases. So we have to go to the cause of the disease. So the cause is the insecurity, the need of love, or that detachment which is happening, the insecure environment, and just unlock each symptom which we did today. And this you should practice in each and every case. Read pathology book, and friends, you will be surprised and amazed to see that pathology is more oriented for a homeopath, because it talks about miasm more. I hope, Dr. Ravina, you got the answer. Dairy products, why I have mentioned, one reason for dairy products is because today the dairy products, they don't come as pure products. A lot of dairies, they use a lot of injectables to for milk and all, and definitely they are the external sources of extra hormones, again leading to hyperandrogenism. If you get pure milk sources, then you can take. This is what ancillary measures talk about, but when we talk about mind, there are other factors also. So, lot of importance of de-stressing, releasing mental catharsis, what we do during case taking, and role of diet and regime. So let's wind up for the day. Let's call it end of the day. I think everyone's answers are solved. Thank you. Thanks a lot. And lots of gratitude for those who have been there. Yes, and those questions who are there, they can definitely share it in the group. Thank you. Thanks a lot. Let's be active in the group also.